You can appear to everyone and to yourself that you're wide awake, but in fact, there's areas of the brain that are actually shut down. And you could go into instant micro sleeps. And those micro sleeps can last up to 4 to 5 seconds where you just pass out. And you could actually travel an entire football field with one micro sleep without any awareness behind the wheel of a car that could be traveling at very high speeds.
Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession.
We're recording this podcast in recognition of all the night shift nurses who will be working an extra hour on November 3rd when the clocks fall back for daylight savings time. November 3rd also kicks off the National Sleep Foundation's Drowsy Driving Prevention Week. My name is Stephanie Olaso, and this is the Nursing Insights Podcast. Today on Nursing Insights, we have Dr. Carol Ash, a board-certified general internist, fellowship-trained pulmonary, critical care, and sleep medicine specialist with more than 20 years of experience in clinical medicine and healthcare administration. Currently, Dr. Ash is Chief Medical Officer and Staff Physician in the Department of Medicine at Robert Wood Johnson University Hospital in Rahway. Dr. Ash is a graduate of Seton Hall University and the University of Medicine and Dentistry of New Jersey. She obtained an MBA at the University of Massachusetts Amherst and fellowship status with the American College of Healthcare Executives. Dr. Ash is active as a board member of Bridgeway Rehabilitation, a community-based organization addressing community mental health and social needs, and was a recent past board member of Elijah's Promise, a community food pantry. Also, Dr. Ash is a star. Have you seen her on The Today Show? Dr. Ash is a frequent contributor about sleep on The Today Show and has even demonstrated on air sleep positions by laying on a bed. Dr. Ash, thank you so much for joining us today.
My pleasure, Stephanie. This is just a real privilege to be with you talking about this topic.
So, Dr. Ash, we're going to be listening to a short clip from a nurse named Ashley Martino. She had an experience driving home after working a night shift in which she unfortunately suffered a car accident due to the effects of lack of sleep, which is so common amongst our night shift nurses.
I have been a nurse for about a year now. Working night shift is a big adjustment. I think that not a lot of nurses know how big of an adjustment it can be on your body. So what happened was I wasn't sleeping. It's very hard sometimes to get on a normal sleep schedule. Like there was times before my accident where I was up for 24 hours straight. I really wasn't sleeping at all, no matter how hard I tried. I tried melatonin. I tried all these different things that some of these other nurses were telling me that might help. So I was driving home after being up for 24 hours because I didn't sleep the night before. And I thought it was okay to drive home. I know sometimes, people might doze off or they'll start to fall asleep and then they're like, oh, I need to pull over. I'm going to fall asleep while driving. But that didn't really happen to me, which is probably the scariest part, I think. I completely just passed out at the wheel. I didn't even realize how tired I was. And my commute is 20 minutes, so it's really not that far. I was actually close to home. I was probably 2 streets down. And I think that sometimes I've heard other nurses, they're close to home and they get comfortable and then they think that it's okay and that, oh, I'm almost home, and then they fall asleep. So I did completely pass out, fall asleep at the wheel. I drove off the road and I smashed into a parked car. And a passenger, the driver, was actually in that car. I smashed on his side. I totaled my car, airbags went off, The whole side and the front of my car was completely smashed. That's what woke me up. The airbags, the loud crash, everything. And I honestly was just very confused. I had no idea what happened, completely blanked out. Thank God I was okay and the person in the other car was okay. His car was also completely smashed on his door side. The police came and, they were asking me what happened. They saw that I had, my nurse badge on. They were like, did you just come from night shift? And I said, yes, I fell asleep. I'm so sorry. This accident was my fault. I felt very bad for the guy that I hit. He didn't do anything. His car was just parked there, and thank God he wasn't getting out. I also was on a street, like a regular street. I could have hit somebody. I could have, God forbid, killed somebody by accident. So it's very scary and very dangerous.
Dr. Ash, could you tell us just some thoughts about common problems with working night shift and how that it can affect sleep?
Well, we've basically got a culture that has normalized not getting enough sleep and pushing through barriers. So unfortunately, we fail to recognize how significant it can be, not only for our personal overall health, but for our patients and for the public as well. There's significant risks to shift work. And there are some basic principles that once understood, we can do some things to mitigate those risks. But personally, it can affect our health in many ways. We know that when you're working night shifts and you're not getting enough sleep, it can cause health problems like increased weight gain, diabetes, cardiovascular disease. It could alter your function of the immune system and put you at risk for infections. And mentally, it can cause you to have an increased risk for anxiety and depression. And it can also affect your performance. Your reaction times are slowed. Your ability to critically think is impaired. You'll forget steps in a sequence. And it just overall, in terms of our patients, it's one more thing that we need to be mindful of, can cause patient harms. And drowsy driving certainly can have a life-altering impact on you and the public. So it really has a far-reaching impact.
Absolutely. And there are so many nurses, and I'm not even coming from the night shift perspective. I did evening shift and had opportunities at which I was called to do a double. I stayed longer than expected from the evening out into 7 a.m. and found myself very tired while driving. And I completely understand how these changes and disruptions to our schedule can really lead to the way that we think being altered. I drive manual stick shift car, and I remember at one point driving tired, my brain just forgot which one was the clutch and which one was the gas. And those are those moments where you're like, thank God nothing happens. But really, having impaired sleep impairs our ability to function. So I would love to hear some of your thoughts about the clip that we have listened to about Ashley's car accident.
Well, I think Ashley really summarizes some of the huge concerns that we have about failing to understand the significance of shift work and how it can cause drowsy driving. Typically there's a misunderstanding that, well, I don't have to drive far and I could just get in the car and I'll make it home. And she really points out and is a perfect demonstration of, we don't realize that you don't often have signs that you're going to fall asleep. So when you're driving, people will say, well, you'll realize your head is nodding, you feel like you're getting sleepy, you start to close your eyes, and those are red alert indicators that you're driving while drowsy. But when you understand the physiology of the brain, wake versus sleep, there's areas of your brain when you have had sleep debt or you're a shift worker that you can appear to everyone and to yourself that you're wide awake, but in fact, there's areas of the brain that are actually shut down. And you could go into instant micro sleeps. And those micro sleeps can last up to 4 to 5 seconds, where you just, as she described, pass out. She actually fell asleep from these micro sleeps. And you could actually travel an entire football field with one micro sleep without any awareness behind the wheel of a car that could be traveling at very high speeds. So it's a very dangerous situation. So you don't always know that you have gotten yourself into a situation that's extremely high risk.
Is there anything that nurses can do to determine if they're safe to drive home?
Well, first, it's really understanding the basics of sleep, right? And so if you understand the basics of sleep, there's two elements to sleep. There's the amount of sleep and there's the timing of sleep. And why shift work is so problematic is it goes against the natural circadian human rhythms. Humans are designed to be awake during the day and sleep at night. And one of the strongest setters of the clock in our brain that maintains those sleep-wake patterns is exposure to light. So you have that pattern or the circadian rhythms and then the amount of sleep. So the first thing you can do is make sure as you're working on shifts that in between those shifts, you are getting the sleep that you need, that you're not creating sleep debt, right? Because you've already got a problem with a circadian rhythm disruption just by the nature of shift work. So making sure that on the off hours, you're doing everything you can to get your rest. Believe it or not, studies have shown daily exercise, your diet are critically important to also make sure that you're offsetting the problems that you'd experience with shift work. And you can take strategic naps. So when you're doing shift work, studies have shown that just before the shift itself, a 2 to 3 hour nap can go a long way for helping to increase alertness on that night shifts. So those are some things you could do. Now, Ashley in the video was reaching out to all her colleagues that had their own kind of cocktails that they thought, like the melatonin and try this and try the other thing. Most major hospitals actually do have sleep experts on site. And I think that, you know, when I listen to different nurses and how they're going about trying to solve this problem for those nurses that are working on shifts, and it's not just the night shift nurses, long hours. So if you're doing a 12-hour shift, consecutive 12-hour shifts, you're going to run into problems with fatigue and drowsy driving as well. So there's a lot of resources that we have. And I think that tapping into those resources, you know, nurse managers, finding those sleep specialists, how can we come up with and change the culture and put together better work schedules and resources and adjust the environment for nurses while they're working so we can keep them safe. So a lot of things that can be done.
That's absolutely wonderful advice. And Dr. Ash, what about nurses who are fresh out of the shift and they are trying to figure out, should I nap right now? Should I go home? What advice or recommendations would you have for somebody in that moment?
I think it's kind of like, you know, for those individuals who are in that HRO journey, that zero harm, the high reliability organization, it's that questioning attitude. If you're saying should, you probably are at a point where you should say, well, let me just take a 20 to 30 minute nap before I get on the road, right? It becomes problematic, right? Because are you going to nap in your car? How are you going to accomplish that? And I think that that's why we need to be really mindful. It's not possible for nurses to do this all by themselves and create the mitigation risk in strategies and environment necessary to really keep our nurses safe. But if you really feel tired, it's the equivalent of driving while under the influence of alcohol. So Ashley said she had gone 24 hours without sleep. It's well known that once you go 24 hours without sleep, your level of cognitive ability is the equivalent of a blood alcohol concentration of 0.8%. And in most states, that's driving under the influence of alcohol. And that's been known for some time. And in the state of New Jersey, we have Maggie's Law. So if there is an accident and a fatality, and they were able to prove that you were awake for 24 hours, well, then it's no longer an accident. It's vehicular homicide. So they very rarely enacted Maggie's Law, but it is on the books because there is an understanding and a belief that these things are preventable by using drowsiness mitigation strategies. But in addition, nowadays we have Ubers, right? So you would never get in a car if you were intoxicated, right? Or I hope you would never get in a car while intoxicated. We have to have the same mindset about drowsy driving.
I had no idea about Maggie's Law, so that is just fascinating. And you bring up a phenomenal point with the Ubers, which is you would never let a friend get into a car knowing that they were driving impaired. We wouldn't want that for our coworkers and our friends at work. So absolutely, if that's an option, that should be right there in the conversation with, if this is the way to be safe, let's do it.
Correct. And, and even if you all these mitigation strategies, you're only human, right? It's no different than anything else. If I said, you're not supposed to eat cheesecake every night, but you might have a couple of events and you'll go off a good diet. Even knowing what you're supposed to do, we're going to make mistakes, right? So to your point, Stephanie, ask a friend if they could drive you home, get that Uber, just be sensible. Don't take the risk.
Before we continue our conversation, let's jump back to the recording with Ashley for a moment, where she reflects more about what happened after the accident.
After that, my car was totaled, so I had off that night, but I did have work the following night. I had to get a rental car. I had to go through my insurance, all of that. I didn't go to the hospital. I probably should have gotten checked because I ended up in the ER like a day later. But after I went through all those steps I had to go through with the police report and everything, I went back to work the following night. And I was very dizzy. I was getting really bad migraines, and I've never had migraines like in my entire life. So I felt like something was wrong with me, something was happening to me. So after I got off that night, I tried to drive home and I still wasn't feeling too well. I had to pull over. I got extremely dizzy. I thought I was going to pass out. I had like a really bad headache. And no one could pick me up at the time, so I had to actually get an ambulance to come pick me up. I couldn't walk, and I told the nurse and everyone what was happening, that I got into an accident like the day before, and that I work night shift, and that the whole situation. So I did get a CAT scan of my head. Everything came back normal, and I talked to the nurse practitioner, and she was like, telling me that she worked nights and the same thing was happening to her. Like, she got migraines out of nowhere. She also has gotten to a car accident before. And she was telling me that it was because I was not sleeping and my body is still not adjusted to nights. I felt almost like delusional at one point. And she actually wrote a prescription for me to not work for 3 days and that I needed to sleep. And I think not sleeping was a big part of the migraines and me feeling dizzy. And then I got into an accident. I think all of that played a role into why I ended up in the ER that day. It did take me like a full 2-3 days to recover from that accident and to like have like a clear headspace. And it also is a little bit dangerous because, we're nurses and we're working with patients and we need to have a very keen sense of judgment. We need to be on top of our game when we're taking care of patients because that's where mistakes can come in. So that was also concerning for me as well as a nurse. It definitely took a long time, and talking to that nurse practitioner actually made me feel better because I didn't know what was happening to me. I was feeling all these things and I was completely exhausted. I'm a very active person. I wasn't able to go to the gym for a while. It took probably months to get on a normal schedule and actually be able to have a work-life balance and be sleeping and your body getting back to normal. Even your eating schedule, there's a lot of things that go into it that you don't think about when you're working night shift. It just happens with the experience. But for me, definitely talking to my peers that have been working nights for a long time and seeing what their experience is, what helped them, what didn't help them, what to do when you're in a situation like that. If you're very tired, just take a nap in the parking lot before you drive home. There's certain things that you can do to prevent these things from happening to you. And I just think it's very important to take care of yourself, because if you don't take care of yourself, how are you supposed to take care of your patients?
it's true. We are only human, and we can't always, like you're saying, we would love to be able to do the exercise and have the diet that we know is important for helping regulate good sleep. But Ashley was sharing in her video that she was trying and was having a hard time adjusting to the night shift sleep schedule. So any thoughts or any recommendations for folks who are starting their journey on the night shift?
Well, there's some individuals who have, because our genetics, they're all different, right? And so there's some people who actually are more tolerant of night shifts. And so, you really have to have this assumption as employers sometimes, well, you have to pay your dues and get in there and do those night shifts. But the reality is night shifts aren't for everyone, right? And so I think the mistake people make is they don't prepare. You want to have a planned schedule so that, all right, if I know I'm going to be doing these night shifts coming up, you schedule your routines and your events the days leading up to it where you're not going into those night shifts where you're sleep deprived. You could start a couple of nights before, adjusting your schedule so you're going to bed a little later, so you'll find that you're better able to tolerate those night shifts, right? So one of the things that we do encourage people to do is when you're a new nurse, working with your managers, and hopefully, as we get better and better at understanding how we can address this for our nurses, you'll have a manager who will understand and work with you if you've childcare needs, you have things in your life that are making it difficult for you to prepare yourself to be on that night shift, then maybe night shift really is not for you. And with the nursing shortage, there's lots of opportunities all over the place for nurses, including the day shift, right?
That is something beautiful about nursing. You will always find patients out there who need your support. There will be a place for you. Absolutely.
Right.
And on the other side, I actually just spent some time over this weekend catching up with an old colleague of mine who had just retired after 30 years of night shift. And she was sharing with me her process of trying to go back into what she calls, regular hours. Yeah. And she was struggling a little bit in that regard. I was wondering if you have any thoughts for our folks who have been night shift nurses for a long time.
It could be really difficult. And, the science, when you read all the different information about how can you structure schedules and how can you shift back and forth from night shift to day shift, it's understanding that it's going to take some time to adjust, right? And it's not just what time you wake up and what time you go to sleep at night. It's all the social events around that as well, because typically people who are on the night shift have rearranged their whole life to accommodate that night shift. And so your brain looks for cues to tell it where it is in the 24-hour day. The light is the strongest setter of that clock in the brain. So what you want to do, whether you're on day shift or night shift, is when you're getting up in the morning, expose yourself to that light if you're trying to go back into that day shift, and keep that wake up time really set and regular. Because if you get up the same time every day and expose yourself to that daylight, it will automatically start setting that clock, and that will set the rhythms that are necessary, the body temperature, the release of melatonin at night, the release of cortisol in the morning, to really facilitate that the alertness throughout the day, and facilitate getting up in the morning and facilitating your ability to drift off to sleep and maintain sleep throughout the night. So keeping a regular routine once you go off the night shifts, making sure you get out, do some exercise. Believe it or not, 30 minutes of exercise 5 times a week, and a diet that's that you want to focus on leafy greens and a good healthy diet will really facilitate your ability to get back on track.
I feel like what you're sharing is a very consistent message that's kind of very counterculture in some ways, that we want to work with our bodies, work with our natural cycles versus taking the energy drink and pushing through it. It sounds like your way is much more holistic and much more gentle with the way that we should approach our bodies.
Well, see, Stephanie, it's really the point that Ashley was making. Think about it. I've done it. When I started out my career, sleep was for wimps, right? If you wanted to be the successful healthcare provider, you were expected to do the 24-hour shifts. I used to hear it all the time. Nurses would say, "Well, who's available to do a double?" right? And you'd have a nurse do a 12-hour shift, and then they'd do another 12-hour shift. And that was really kind of the mindset that nurses were really thick-skinned, and even as physicians, that, that was the expectation, that this was going to be a career where you were expected to be at the bedside and the image of us as heroes, right? And the reality is we are only human, and we have the same physiology as everyone else. And what's really shocking when you look at the statistics, there's 1 in 25 people that have reported actually falling asleep at least once in their lifetime, and 60% of the population saying they admit to drowsy driving. And in nurses, the statistics are even higher. So it's when you think about that and the consequences of just falling asleep for a moment in a car, this is so prevalent throughout society because we've really normalized pushing through, and that sleep is for wimps, and we can sacrifice sleep to accomplish more and more and more. And it's actually the reverse. When you don't get the sleep you need, your memory is impaired, again, that critical thinking, your judgment, so your performance, your mental and your physical health all take a toll.
That's all we have time for in this episode, but there's so much to cover because this is such an important topic. So we'll continue our conversation with Dr. Carol Ash in the next episode. My name is Stephanie Olaso, and we'll see you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.